All right, so we're back. Potentially not live, but hopefully the conversation is still live, and people who want to see it can see it a little later. So May, I think you're up.
Yes. So let me just say something very briefly about my work. So let's see. So my previous work was on the translocal circulation and refiguration of traditional Chinese medicine. So, when people ask me at parties, what do you mean by traditional Chinese medicine? My answer these days, I don't want to get into a long conversation, is that it's not really traditional or Chinese or medicine as we know it, right? So if somebody wants to know more, I can talk on and on about each and every one of those words. But the point is, of the book and the project was that what we've come to know as traditional Chinese medicine was not made prior to translocal encounters and entanglements, but actually emerged out of it, out of these entanglements and encounters at various historical moments, right? Continuing to this day. And the process of knowledge production, right, of knowing Chinese medicine, of doing Chinese medicine, is also a set of processes through which particular visions, understandings, and practices of what makes up the world and our places in it. So that book was written, I think, at the height of anthropological and also social scientific research and publication on globalization, right? So that was part of the sort of the feminist and STS intervention to say that wait a minute, right? Actually, there isn't this overarching thing, right, called globalization, where you have what we had, and what we have now, and will probably always have, are these situated processes and projects that are played out on these uneven fields. And instead of producing a uniform global economy or a uniform global culture, what happened through these transnational projects and processes is that certain differences and inequalities are reproduced, reinforced, whereas other kinds of differences emerge through these same projects and processes. And I think that's still relevant in today's world, right? As we take another look at this thing that we call globalization. So that was the first book. And then, of course, after I was done with it, because I spent about 10, 15, 20 years on that project, I just didn't want to do traditional Chinese medicine anymore. I was done. But it came back to me, and as I found out that there were all these new projects that people were doing in urban China on what they call sort of, mostly through small startup firms, right? Just the last, it's 2013, about the beginning of 2010s, continuing to this day. So these are it's a new phenomenon. And it's very heterogeneous. So I've been interested in people who practice and teach traditional Chinese medicine, and a lot of times what they call classical medicine, that are different from the sort of the scientized and standardized form of traditional Chinese medicine that's not only practiced in China, but also sort of what we are familiar with here in the United States. To give an example, so they would embrace a lot of the Taoist ideas, analytics, and also pre-Taoist ideas and analytics. And what was also interesting and continues to be interesting for me, and that gets to the question of knowledge economy is that a lot of these people who engage in this new kind of entrepreneurial Chinese medicine are people who had prior careers, who are young, right? Anyway, well, anyone who's younger than me is young. So we're talking about people in their 40s, 30s, even 20s. A lot of them had prior careers in working for large corporations of various kinds. And they turned to traditional Chinese, turned to Chinese medicine, not necessarily, well, to find something different. A lot of these people told me that they wanted to find their humanity again. They wanted to tear off labels, right? They couldn't put up with the 996 ICU working condition anymore. I don't know if people are familiar with that, right? So from 9 to 9, 6 days a week, ICU, right? You end up in ICU. So so there's a lot of that going on. And then the current project is entitled Bring Medicine Back to Life. So the movement is to kind of take healthcare back into your own hands instead of leaving them in large hospitals that are being, privatized, leaving them, getting caught in these tensions between doctors and patients in China, which, these relations have been pretty, very fraught and sometimes quite violent. So that's sort of bringing medicine back to life, how to think of medicine not as a compartmentalized, practice, but also but actually as part of your everyday, right? Thinking, doing, and being. And another way of thinking about sort of bringing medicine back to life is also how to reanimate these seemingly archaic ideas and concepts and animate them sort of so that they would enable people to live in a deeply disharmonious world. So there's a sort of it's really an ethnography about the everyday, about critiques at a deeper level. It's a critique of modernity. It's a critique of anthropological inquiry. What do we have to contribute, right, to understandings of this fast-changing, often very bewildering, volatile world? I came from a background where I thought, yes, we have to do STS, right? We have to bring STS into anthropology. Back when I was in graduate school, I'm at a point where I'm rethinking, so what does anthropology have to say? What is our voice in this world? And I do think that anthropology has something uniquely important to contribute. So that's pretty much it. And I can talk about, so I'm here, I think, Nick, because I wrote an article that came out in 2005 on SARS. And that was kind of an in-between project and was totally unexpected. I did not expect to write about SARS. I was going to go to China in 2003 to do some follow-up research on my first book, which didn't happen because of SARS. So I went in the summer, right after that ended, and was really struck by this feeding frenzy, right? This sort of kind of returning to consumption with a vengeance right after the SARS epidemic. So just think about the corporeal politics of consumption, right? Of Orientalism, of media representation, but also everyday practice. So the article was part of, I think, a collection on emergence in 2005. It was American Anthropologist, and the title, which I'm proud of, is Civet Cat, Fried Grasshoppers, and David Beckham's Pajamas. So yes, and then Unruly Bodies After SARS. So, and unfortunately, it has still, it's still relevant today. I wish it wasn't so, but we are. So.
Well, thank you. And we are now live. I don't know how many people are here, but hopefully we'll have questions at the end. So thank you for the introduction. So now, very broadly speaking, I think the plan that I sort of was thinking about suggesting is moving from the tracking, which is more the pandemic surveillance and wet markets and those topics, to the treating and what is treating. You know, we can talk about that if that's even an appropriate term, but addressing more directly Chinese medicine and thinking about how it relates, sort of, especially in this moment, in relation to COVID, what COVID-19, what critical part of a conversation maybe is often overlooked can it offer. So so let me start by well, why don't we? I mean, you set it up well. Why don't we go to your article, which I think is extremely relevant today, and. Yeah, you started, maybe you could say a little bit more. You started to say the consumption. I mean, you have this really interesting approach in it, and it is linking together a way of seeing that I think is very destabilizing in an interesting way. So maybe you can explain the different elements in it and how they relate.
I'll do my best.
Okay.
So let's see. So when SARS broke out, so in spring 2003, kind of very mysteriously went away in around May, June of the same year. A lot of the media representation really focused on the zoonotic origin of the disease, and also linking the zoonotic origin of the disease with the wet market, right? So basically, you know, how sort of dirty, uncivilized, and backward these practices were or still are. So that was actually one particular idea. And at the time, I think there was also a lot of anthropological studies of consumption in China, right? And that made me think about consumption not only as Foucault would have it, or, you know, as a lot of us talk about, as a sort of a discursive, you know, process of subject formation, but also as a kind of a gritty corporeal practice that conjures a lot of the older imaginaries. In this case, some of the, you know, Orientalist imaginaries. So the term, and Lyle, you can correct me if I'm wrong. So I became actually interested in the term wet market because it was all new to me, because I had never heard of that term before prior to SARS. And I talked to my other colleagues who told me that actually it's a term that came out of San Francisco's Chinatown, not out of China. So that, again, sort of gives you an idea of these translocal, right, imaginaries of what the wet market is. And then actually, I think after SARS, there was a lot more attention on wet markets in San Francisco's Chinatown too. And there were these, you know, people who sort of did their investigations about how horrible this practice was. I think there was a report of, was it a raccoon being boiled alive at, you know, at the in one of those wet markets in Chinatown, and then the owner retorted by saying, "Oh no, we would never do that because the raccoon wouldn't taste good, right, boiled." So so there was a lot of sort of focus on that kind of corporeal practice. The irony is, you know, a lot of these so-called wild animals were actually farmed, and they were brought onto the table not because it was an ancient practice, but because of massive consumption that was taking place in China and elsewhere at the time. And another irony is that, you know, when I went back to China in 2003 to do my follow-up research, the remedy, right, for the social remedy or economic remedy for SARS was more consumption, even more consumption, right? So that was something that I was very interested in. And for me, I mean, it really showed that wasn't just an isolated phenomenon that's particular to some kind of, ancient cultural practice, but rather very much part of the present, in which, all of us really are involved. So, yeah.
Thanks. And maybe just one follow-up question on it. I mean, to bring it into the present, how do you, I mean, this is a moment where in this country there's incredibly intense anti-Asian racism, and I just saw that 26% of Asian respondents in a Pew poll said that they have recently feared a physical attack. So the moment that we're in now, it seems that I'm curious about how you see the analysis of that paper playing out today, and what, if anything, is still, clearly lots of things are different, but how it might connect to the moment.
Me?
Yes, or anybody, but I was thinking you first.
Yeah. And, unfortunately, I think we tend to fall back on familiar tropes, right, in times of crisis. And I can't really think of a pandemic or a large epidemic without some group being blamed for it, right? Going back to the 1347, 48, the plague, right? And then all the way through Typhoid Mary, and now the new pandemic. So I think there is a way in which that these old imaginaries are very, very deep-seated, shaping how we understand. When we talk about understand the world around us, it seems very abstract, but actually it's not. I think more than ever, right, it is a very intimate aspect of who we are, as individuals and as a society.
Anybody else want to jump in? For reasons of time, maybe we can talk a little bit, because I think this is you're right, that there's an interesting overlap between your project and Lyle's, because it really is, the wet markets are a big part of what you've been working on, Lyle. And you also have recently been writing a bit about policy around this. Do you want to, what's been happening with wet markets, and what have you been, what are you worried about?
Well, I mean, one interesting thing about this, the current outbreak, is that the claims about wet markets, so there's been the sort of massive racist response and really geopoliticized response from the US about wet markets, among other things. But within China also, there's also been a lot of claims about these kind of live animal markets being uncivilized, and to the need to shut them down. And so, yeah, I've been interested to follow those claims and how that's actually played out in some of the regulations that have been instituted. So there was almost immediately a temporary ban on wildlife trade and wild animal markets, and then that was turned into a permanent ban in February. But so in my fieldwork, I was doing some parts of my fieldwork were actually working with some wild animal farmers in Jiangxi province, specifically farming swan geese, which in Chinese is called dayan. And that's a species that's sort of the ancestral species of the domestic Chinese goose, but it's the breeders were trying to maintain it as a wild but farm, so bred, born, raised, everything, but keeping the traits that distinguish it slightly distinguish it from the domestic in order to maintain a higher value. And that's just one example, but there was, as May was saying, there was a huge growth in wild animal farming industry since the 1990s. This was not a traditional practice whatsoever. And so when this ban has come into place, there's of course been also a backlash or a response from some of the farmers, because it's, you know, some estimates, it's I think I don't know if I'm going to get the numbers wrong. I think I'm going to say it's 18 billion. No, would that be right? 18 million. The amount of money involved is huge, and the amount of people working in wild animal farming for food is also huge. So the impact has been big, and you've seen, there's been videos, I don't know, you can see some videos of people profiling some of the wild animal farmers, and, you know, suddenly, you know, they've been raising animals, they have all of these animals, they put in huge amounts of investment, took out loans, suddenly from one day to the next it was banned, then they have to hold them or eventually slaughter them for compensation, which is usually much lower than what they would have gotten otherwise. So that's one thing that's happened. And then the follow-up, the next stage, I don't know if others have been following this, but there's actually been some new regulations put into place that have, so the wild animal farming previously was referred to as special type husbandry, 特种养殖. And that was regulated under State Forestry Administration, not Ministry of Agriculture. So they were regulated as if they are still wild animals, but, you know, they're being raised on farms. Everything about how they're raised is exactly like farming a pig or a chicken, but actually they're regulated as if they're wild animals. Now, what's happening now is that's being, so a large number of those species is now prohibited from raising altogether, but another set of animals are being shifted into what's called special type livestock and poultry, 特种畜禽. And that's including species like mallard ducks, mink, and what's another, sika deer, some species like this. So some of the species that I think have maybe more vocal kind of or powerful. There's actually a set of different reasons why these are being included. It has to do in part with the fact that they've got established mechanisms for farming, and things like that. But so that's sort of the consequence that's been happening. Yeah, I don't know. That's what I guess what's interesting to me about this is that what ends up happening is that it comes down to really a complex discussion about what counts as wild and what counts as domestic. And in terms of the sort of longer view, as we look forward to sort of trying to prevent future pandemics, the focus, to me, the focus on wild animal farming is a little bit misguided, because many other pandemics recently and in the past have actually emerged out of conventional farming. So we could look back to the 2009 H1N1 swine flu, which emerged out of North American industrial pigs, or we could look to another emerging virus, the Nipa virus. It also comes from bats, but the intermediary species in the outbreak that happened in Malaysia and Singapore, it spread from bats to industrial pigs, and pigs were the amplifier species that then actually caused it to spread to humans. Otherwise, it never would have. And so there has been this focus on wild animal farming and wild animals as being kind of exotic consumption, as May talks about in her paper also, and that therefore this is strange, this is exotic, this is unusual, it's easy to close that down. But the reality about preventing zoonotic pandemics is that it really has much more to do with the scale of animal consumption overall, and including this increasing scale of wild animal farming, but it's the scale of conventional farming is vastly, vastly bigger than that, and is definitely still something that we should be concerned about.
Thanks.
I can add one is the famous patriotic hygiene committee. After the Beijing new outbreak in June, they issued a new policy. It's not really new. That they want to enhance in terms of wet market, all the market and the literary word said we need to enhance the market environment, complex ordering and governing. So we need to make a clean, hygienic, urban, this is 城乡环境, urban rural environment. So basically, they kind of put the so-called wet market always at the margin of urban rural. So actually, this new policy is really targeted on so-called wet markets in China. And when this Beijing, the big market in Beijing was identified as a center of this new outbreak, and then there were reports about the environment and then especially the wet produce, not produce, the fish tank, all those. It's very similar to what May was talking about, how people perceive why it's called wet market. So a lot of report about that, and the policy came out, and then the patriotic hygiene committee started to work again to enhance those environment, the market.
Interesting.
Can I ask a quick question? Because I've been seeing that something like that policy, is it the case that there's a move towards banning all live animal sales, including live poultry? Have you seen that across the country? Or because currently, I mean, there's still live poultry markets, right? And I think it's something I've looked at in the past as well. But I just read recently that there was possibly a move to completely banning those altogether, but it seems like that would be quite intensive.
Yeah, I remember there was a temporary ban during H5N1 outbreak. A lot of places they banned live poultry. But this I haven't seen.
Okay.
I had one more question, sort of about pandemics and international collaboration, which is something I know that you've also looked at, and sort of, you know, in the news, there's so much news, but you know, recently with Houston consulate being shut down, and the real tensions between U.S. and China that are in many ways fueled by the pandemic in so many very complicated ways, it seems like. And also, you know, the U.S. Announcing the withdrawal from the WHO. I'm curious about the history of U.S.-China collaborations during pandemics and how it's played out in different times.
Yeah, I mean, I could talk about this for a very long time, but I don't want to do that. So I'm going to talk about. I think we could go back to the first real global efforts. Well, it's not the first global efforts, but the first sort of like extensively coordinated global efforts to monitor and detect pandemics was developed by the World Health Organization immediately after its founding. It's one of the first projects that they developed, which was called developing what's now called the Global Influenza Surveillance and Response System. It used to be called the World Influenza Program. So that was developed in the late 1940s, early 1950s. And interestingly, there was the first pandemic it was able to monitor was in 1957, the 1957 flu pandemic. And the first reports of it came from Singapore, and they eventually claimed that it originated in China. The irony of it, though, was that during that period, so they developed a network of laboratories, basically, with countries around the world who would send in reports as well as virus samples to the center, which is in London. But the irony was that during that period, after 1945, after 1949, mainland China. So China was one of the founding members of the UN and the WHO. But after 1949, the representation of China was held in Taiwan. And so mainland China was actually completely not represented within the WHO between 1949 and 1972. And then after 1972, Taiwan has now been played that same role, where it's essentially does not have representation within the WHO. So what's interesting is that in 1957, a Chinese scientist named Zhu Jiming was, who had worked with the WHO developing this influenza center, had returned to China and actually isolated the virus, identified it as a novel strain that was likely to cause a pandemic. But there was no communication between China and WHO until maybe several months later, after WHO had already detected it. And so this was not, so there's a lot of talk about during SARS, like maybe that China doesn't report and things like that, that they're not a good participant. But we have to remember, there was a period they were actually excluded from being a member of the WHO during a large portion of the 20th century. Then since then, after 1972, there's been a lot of efforts to develop new collaborative arrangements, and I think the US playing part of a role in that as well. I think Catherine Mason's work, which people might be familiar with, actually really documents a lot of that around human public health and the CDC and the role of the US CDC in helping to kind of design as well as train people involved in China CDC. And they had very, very close relationships between US CDC and China CDC until in 2019, Trump pulled most of the staff from US CDC who were based in China out. That was in the summer of 2019. And so you have this, you hear people in the US administration right now complaining about how China's not allowing them access into China. But it's ironic because they had a very large team of people working with China's CDC, who are the best scientists on this topic in China, until several months ago when they were pulled out. And so that's sort of one set of the stories, I'd say.
Thanks. So maybe it makes sense. I want to have enough time for treatment, the placeholder for thinking a little bit more about Chinese medicine and the current moment. So I wanted to ask Lily and May, maybe you can help us. Just with a very simple question, what exactly does traditional Chinese medicine offer during a pandemic? What are people seeking when they're looking for a practitioner, and yeah, what's done?
Lee, do you want to go?
Yeah.
Oh,
go for it.
Sure. So I need to before I say anything, the clarification is that you mean the treatment, the patient, or you mean prevention, like just in case?
I guess I'm trying to keep it open. So what's the most common forms of interaction? Yeah. Okay.
So actually, why I was very much interested in this topic you brought me on is because Chinese medicine's role in this pandemic. Because I was in US during the SARS, so I had no experience of SARS, and only this pandemic gave me a very deep impact. So Chinese medicine's intervention into COVID-19 was, to me, it's relatively early. But actually later I heard in Hubei, where the epicenter, when it started, they didn't want Chinese medicine to go in. But the Chinese medicine, the state administration of Chinese medicine sent team very soon, maybe even before the New Year, and before the January 23rd. So it's very early, and then at that moment, it's more about working with the ICU expert about how to Chinese medicine can help to relieve the symptoms, and then people started to talk about how to use Chinese medicine to treat the not very serious patient, but they tested COVID-19. They have light symptoms, but they can be treated specifically in Chinese medicine. So that's how it started, brought mass media's attention, and then they started to set one hospital in Wuhan, it's the field hospital, and to use Chinese medicine. But of course, as May said, the Chinese medicine is not traditional, and it's never traditional actually. So it's integrated, and people still taking biomedical treatment, but they want to use Chinese medicine as main method. They also combined with, for example, exercise, and some. I don't know what's really going on there, but I imagine there also will be some like the herb, the aicao, and all those health enhancement measures to do that. So that's for treatment, and there have been a lot of news reports about how the Chinese medicine expert talk about the formula, how they thought about the dynamic behind the symptoms, and how they use Chinese medicine to intervene with the treatment. That's for the hospital, and for the ordinary people, there are already a lot of debates and controversy. And early on, like at the beginning, the Shuanghuanglian debate, the one research institute issued announced, they said this specific patent medicine is good for COVID-19. And then everyone was rushed to the drugstore to get that. And then it's the rumor, not rumor, the joke was even that, because that kind of patent medicine also can be used for animals. And then even the veterinary medicine was sold out, and by people, by human beings. So that's but immediately next day, then they announced another now I don't recall, maybe it's local, it's authority government, and saying no, it's not effective, and you shouldn't go by that. And then so that's put a huge backlash and then on Chinese medicine, and a lot of public discourse was started to criticize Chinese medicine always being opportunistic. Whenever there's pandemic, there's Chinese medicine playing a very bizarre and ridiculous role to try to attract ordinary people to buy it, but actually it's fake. So all kinds of debates came out. Without Chinese medicine, this has been controversial all along. And started from the Wuhan in the center when they issued some set of formula as standard formula for all patients to drink, to use that formula, Chinese medicine formula, to treat patients. And then there has been a lot of controversy, and then there are also reports about patients refuse to take it. And then there are also reports about in those field hospital, someone recovered from COVID-19 saying, I never drink any Chinese medicine, I deny it. And now I'm back, I'm fine, I don't need it. So there's always this kind of controversy about, is Chinese medicine fake? And then does it really work? People are being really polarized about for Chinese medicine or against Chinese medicine. But one thing for sure from my small research is almost all hospitals in Wuhan, they have provided Chinese medicine, herbal medicine, ready-made soup for patients. And they have already, even Chinese medicine the nurses, they just take the formula and then they make it and then they bring it to the patients. So it's kind of required, but patients, they don't have to drink it, but it's provided. Yeah.
That's really interesting.
So that's very much. Go ahead.
I think what might not be obvious to the audience here is that Chinese medicine is actually a lot more controversial in China today than it is in the United States. So it wasn't so 20 years ago, right? Before, you know, Chinese medicine really went mainstream here, but today that is the case. So, you know, whereas we might think of, you know, herbal medicine as a potential treatment or cure for SARS or COVID-19, you know, we need to understand that in China, a lot of people view Chinese medicine also as a symptom of China's backwardness, right? Sort of something that is pseudoscientific, proto-scientific, or even anti-scientific. So those are the sentiments that made the use of Chinese medicine, especially during these epidemics, extremely controversial and problematic. Because it's not necessarily viewed as the cure, but rather as part of the problem.
Yeah. Thank you, May.
Yeah, thank you. It's fascinating. I mean, maybe I know that I think all of us, one's ability to do research has really been disrupted in many ways these last months. But I'm curious. I mean, I guess it would be helpful to hear a bit. Lily, you mentioned that you are participating in a study that's about to start. What are you going to be looking at?
Okay. Yes, this project started from this controversy, and also with my background in Chinese medicine, I can see how Chinese medicine would work for this pandemic. And I was puzzled by why people had such a strong feeling against it. And meanwhile, as I mentioned yesterday, there's a student who has been collecting all the media reports about Chinese medicine contribution to COVID-19 during the pandemic. But she realized actually all the news media reports, they are very vague. They're not persuasive. If for someone who's already very suspicious of Chinese medicine, the news report is more like a propaganda. It doesn't say substantially how Chinese medicine work and why and in what sense, and also how the patients feel like. There are media reports about the patients was very happily in the field hospital doing Tai Chi or doing those Ba Duan Jing, those traditional Chinese medicine related exercise. But still, it's all looks superficial. So that also brought our attention to think about what is really the relationship between traditional, if we call it still traditional Chinese medicine, and COVID-19, and what's really going on in the clinic. That's what we really want to find out, and how the Chinese medicine doctor, when they're facing the patient, how they process that. And we did find also some interviews online and of those very famous experts who were in Wuhan, giving their thoughts about the dynamic, the mechanism behind behind COVID-19 in terms of Chinese medicine, how they think of that. For example, the dampness, and then one expert called it 湿毒疫, with the dampness and poisonous pandemic. So how Chinese medicine can work with that. So then we decide to, but everyone is locked down. We cannot go out to do interview. And also to find those doctors is not easy. It's not it's complicated, because some doctors, they declined our interview request, and maybe out of different reasons. Some can be even just because I was Eric Karchmer, he's American, he's working with us. and being American can be a sensitive issue. It's just hard to say. So then we started with ordinary people. We started with common people, how they perceive Chinese medicine during the pandemic. So, and interestingly, and they are, one thing is I have to say out loud, oops, sorry. I forgot to silence it. The one thing is it's very mixed. So people say, yes, I use Chinese medicine to enhance immunity, to enhance my capacity to resist the virus. So they mix together with this Chinese medicine idea. They use, by the way, they use, for example, 灵芝孢子粉. It's a kind of mushroom. It's very May has been doing this kind of research. She knows it very well, because that's kind of very popular in market. Like people think that's it's part of Chinese herbal medicine, but it's already being used in terms of like a biomedical like function, like enhanced immunity, for example. And then this interviewee, she said her mother just offered that, and then to enhance immunity, that would be good for to deal with COVID-19. So and we do, and also a lot of young people, they don't think Chinese medicine would work at all. They think it's ridiculous, especially if they read newspaper report about how Chinese medicine doctors work with ICU experts. They ask, how could Chinese medicine work with ICU experts? Can Chinese medicine put into by the what I don't know, 气管插口, anyway, by those very complicated high technological intervention of the body. So it's ridiculous. So that this kind of polarized idea still among common people, and it has some age sensitive, and then younger people, they're more kind of, I don't buy it. But of course, if the young generation, they have family influence, have some family members who are into it, they may be different. But in general, we see this age difference. And then older people, they kind of more leaning toward, or they are more willing to accept Chinese medicine does work for this pandemic. So that's usually what we found among ordinary people. They are still, they don't think, they think the quality measure is most important, and but taking anything to prevent it, it's not, it may not work, and it may be just some panacea. It may be just some psychological effect. So that's what we were seeing now for ordinary people. Yeah, we still try. We're going to interview more doctors.
That's fascinating. May, I wanted to ask you a little bit about your focus, as I understand it, more recently has been on these entrepreneurial sort of, as you put it, sort of not some outsiders to at least to certain communities, but also people who are business people. Can you say a little bit more about who they are and how they're located in relationship to other medical practitioners?
They are, let's see, it's a very, very diverse cluster of people. So, they're interesting to me because of their engagement with obviously capitalism, right? And how they sort of get their funding through, a lot of times, venture capitalists, but also sort of trying to convince these investors that it's something that's worth investing in.
Mm.
And if you look at China's economy today, a lot of these investors are in for just a very quick turnaround, right? I mean, that's the case for these startups in general. But how they actually convince people, well, you are not going to get the returns you want right away, right? How to kind of think about the temporality of business in much longer terms. And also interesting to me that that a lot of them are now caught up in COVID-19, not only the epidemic, but also the financial economic fallout. For a while, like every time I sort of check back in, I always wonder, are they still there, right? Have they closed down? Are they still there? So that's interesting to me. It's also interesting to me, it's because it's a different kind of, it requires us to rethink what's socialism and what's capitalism, because it really is neither, right? If you look at what these small firms do, they're very critical of kind of large practices of large corporations, because a lot of these people worked for them and were unhappy with what they found. They were not happy with privatized healthcare as patients / consumers who really bore the brunt of some of the consequences, right, of privatization. They're also not happy with sort of the limits of scientific materialism, that kind of worldview, even though they were brought up in it and deeply invested in it. So for me, it's an interesting question of how to live sort of, deeply within, let's just say modernity, right? But still able to live thoughtfully and to do something different. And that's important, I think, for anthropologists and the social scientists, because we often go into the field sort of armed with our theory, right? So here's neoliberalism, here's globalization, here's whatever, dialectical materialism, right? And the lesson that I learned from these people that I work with is that sort of the importance of paying attention to immanence, right, to specificity, to what happens in people's everyday life. And I think that's something that's always close to the heart of anthropology. Maybe I'm just getting old and sappy, right? So I'm, rethinking myself as an anthropologist rather than a kind of an, in my more kind of edgy, kind of, I don't know, younger years. But I think there is something important that anthropology pushes us to think, right? I mean, we make fun of relativism all the time. Well, not all the time, a lot of times now, right? But it does give you a kind of framework to kind of take seriously the diversity and the difference in this world, and not just the kind of diversity and difference that can be accounted for using existing theoretical frameworks, right? Using the ideas that we are already familiar with. The world is actually a lot more wild than we could possibly imagine. And the best I think we could do, well, maybe not the best, we could start by, trying to co-imagine these complexities and contingencies without, being limited by the tools that we have available to us. It's actually, what I'm saying now is kind of a very Taoist thing, right? It's like the constant emptying out, right? Every time you encounter new phenomena, new people, new relations, as we do, right, today, right now, it requires a kind of emptying out of, I hate to go Boasian on this, right? So prejudices and preconceived ideas, but but kind of along those lines, kind of suspend what we think we already know, and really, because there are a lot of things we actually don't know.
So I want to hopefully to our audience out there, hello, thank you for being with us. If you want to ask questions, feel free to, they'll get relayed to us. So now would be a great time to take potential questions from the audience if we're being live streamed, which we believe we are. But in the meantime, I have maybe another question, and feel free to, if you guys should jump in and talk to each other as well. But this question of scientism and seeing both of you mentioned it, but actually in different ways, and sometimes Chinese medicine is being on the side of scientism, as I understood it, Lily, in an earlier comment you made. But we haven't talked yet about what are the people, if this is a polarized moment, what are the people who are polarized against scientism in China? What are they reacting to? And is there a specificity? Is that conversation playing out in a different way to what's happening in the US right now around face masks and all sorts of questions? I guess a crisis of the legitimacy of well, I don't know, of the presidency, but of authority more generally, a public health authority to speak in the name of science.
Public health authority is unmovable in China. It's definitely very has only it's very much authority. Everyone listens to them. It's I don't see actual anti-scientism, but there are, of course, Chinese medicine being so much criticized and pressed, and then there will be people reactionism, like react as, well, we don't, we need to rethink about science, and then there are people who want to trying to talk about Chinese medicine, because Chinese medicine has been very much scientized since very early on. A lot of people already talk about that. Here I have an anecdote I wanted to tell a moment ago. Bruno Latour came to Shanghai in 2016 or 17, 2017. So he held a small workshop in Shanghai. I attended. And my group was a small circle of people who were interested in Chinese medicine. So our task was talking about Chinese medicine. So then our final report to Bruno Latour is, okay, you said we have never been modern. We can tell you Chinese medicine has never been traditional. So we kind of phrase his idea of we have never been modern. We say, for Chinese medicine, we have never been traditional. So in that sense, Chinese medicine, especially the institutional Chinese medicine, has been very enthusiastically embrace science, and they enthusiastically think science is very important, and Chinese medicine need to follow to come along with the time, with the era, and then to be more scientific. But of course, people have different approach to science and have different way to perceive science, to do science. I imagine, for example, Lai's research, those farmers, those breeding farmers, they thought they're doing some science as well. That's my, I would imagine they may claim that. So I don't really see real anti-scientism here. And then science is about everyone. It's very important, and it has the say. But it's really, it's up, if we come down to on the ground, it's really up to how people understand science, how people perceive it. So that's very different. So in terms of the measure, like in contrast to US, I was thinking of two. I think why call it scientism? Because it's really, it's already become a state ideology in China. So the state work closely with science, and it do many things under the banner of science, claim the legitimacy, and people go with it. It's follow it. When I prepared your question about what's going on in Beijing, for example, maybe you saw the report already, the new outbreak in that market, Xinfadi market. So, and from June 17th to June 11th to 17th. So that's one that has most outbreak compared to US. It's nothing. It's 158 cases, and then they mobilized 7,120 communities and over 100,000 community workers to deal with this situation. And people go through the test. And from June 6th, it started its outbreak was June 11th. On June 16th, already 500,000 people went through the test. And by July 5th, it's 110 million people went through the test just because of those 158 cases. And then immediately in June 19th, and then Beijing, no people in Beijing are not allowed to go out to travel outside Beijing. And then all the middle school and the elementary school, they just started I think they started June 1st, back to school, and then shut down again. So it's how to say, it's really beyond imagination to me. It's like people just follow it, and then no question. And everyone started to work on that, and everyone praised public health authority to do this. And so you can, just this small example, you can tell how much people already give the public health authority. And everyone has this agreement. Yes, we everything you do is to protect my health, and then just in case. And then so it's amazing to me. And and also I can talk a bit about the flood disaster recently. There are a lot of reports about how local families, they in order to protect the bigger city downstream, and then they agree to let the flood their own houses. It's a report like this everywhere in China. Mm-hmm. It's fascinating to think about it. So I want to add one thing, back to May's point. Yes, the world is much more complicated, and it's not like we simply say, oh, the Chinese people are so submissive, they just follow whatever being told. No, I think people actively make their own decision. Yes, it's not like I'm forced. If I do against it, I'll be punished. Yes, they may be punished, but the more it's like I agree with it. It's their own decision to follow. So that's something I think we need to really think about in terms of this, all the term of individualism of the agency. And do they lose their subjectivity? And then the state-people relation, and there's a lot to be rethink of.
Well, I'm gonna stop asking questions, but do you guys have questions for each other or things you want to follow up on?
I really want to learn about everybody's work a lot better.
There's some there are neat intersections between what you do.
I have one question for Lyre, is because it's interesting you talk about the ban of the wild animal and the farming. Do you see this space for those entrepreneurs, the farmers, to claim to argue back, to say, but I'm farming the wild animals, so they're not wild animals. They can kind of find a space to go beyond this restriction?
Yes, definitely. So it's not going to happen to all species, but it looks like, because what's happened is it's basically a regulatory change. Instead of having it classified as special type husbandry, the law now says you have to be farming to farm anything for food. It has to be counted as livestock or poultry. Mm-hmm. but then the question becomes, then within the regulation put out by Ministry of Agriculture, there's two categories. There's traditional livestock and poultry, which is chickens, ducks, pigs, quails, and so on. And then there's special type livestock and poultry. So these are the species that could be where you have a space to argue that what you're farming has become a kind of livestock or poultry. And interestingly, if you go through they stipulate why each species is included. The reasons are a bit different for each species. Like for some, this is a traditional farming practice for some ethnic minority groups. And so that's one rationale for including it. Another rationale is this is something that's actually been farmed for many years in other countries, like alpaca, for example, or ostriches. So those are allowed. And then others are because the techniques have developed to a significant level. So, yeah. But there's definitely going to be a range of species that will not be included. And I've seen videos. One of the most, one industry that seemed to have grown quite rapidly recently that's gotten a lot of publicity was bamboo rats, I guess. And then there's some videos of the farmers. There's some videos of the farmers of that who are saying that they've tried to push for whether they've not been allowed to start. So yeah, they're not.
Yeah.
Thank you.
Can I ask a question about scientism quickly? Because I in terms of critiques of scientism within China, I thought one area, something I've been doing fieldwork on more recently, which is a different topic, which is related to rice genetics research, and in the context where there's a lot of controversies around GM rice. And I thought that was one area where it seems like there was quite a significant pushback against the science, and that actually eventually the state adopted the position of safety, precautionary safety against what, I mean, the fieldwork I'm doing was with actually the scientists themselves, and for them, there's nothing dangerous about this at all. You know, I mean, this is similar to scientists in the US and Europe who work on genetics and GM. They don't see any risks to this, but popularly it's seen as something risky, and some of the critique of the safety of it has then, I think, taken up criticizing sort of the power of science and the claims made by scientists, which are maybe more stronger than they should be, I guess. So I don't know if anyone has thoughts about that, but it's a kind of parallel case.
Yeah, this genetic modified food has been, very similar with Chinese medicine. People have this joke: if you want to break up with someone, you start to talk with them, either one about Chinese medicine, two about GMO food, and you will be divided. Yeah.
Interesting.
So, but I think it's similar with Chinese medicine. It's like people would, especially lay person, would immediately put them as a different group and polarize them, saying they're actually they're against each other. But there are also people who are saying, like, I'm not in the field of genetic modified food area, any research, but from my reading, there are still people claim that there are scientists also saying genetic modified food has long-term impact on human body, on health, and so both sides they both hold the banner of science to against each other.
Right. Right. Yeah, that's true. Yeah, I guess I see what you're saying. A lot of the debate is about what science should be, I guess, rather than completely abandoning science altogether.
Right.
But I guess I was thinking perhaps also for historical maybe reasons that public health authority is much more authoritative than agricultural within China, and so that might sort of agricultural science versus public health science, right? The public health science is really that's a very powerful authority.
Yeah.
And there's also a deeper query into scientism, not just science itself, but also the epistemic scheme, right? That enables it. So specifically, sort of Cartesian dualism, right? Seeing the world in twos, which we unfortunately do, increasingly. Well. Anyway, so yeah, so for these classical medicine people, right? So how to think about their thing is 天人合一 or 天人相应, right? So the heaven, the human are one. So what happens when you start from the position of one instead of seeing everything in two? So there are all these, there are also these deeper, larger, but also more specific queries into ways of thinking about the world and how to inhabit it as well. So
yeah, that plays actually in life's work too. The wild animal, the domestic animal.
Absolutely.
Yeah.
I would just to bring it back to COVID-19, there was an interesting article just today by Charlie Wenzel in the New York Times that talked about, he actually talked to medical anthropologists and doctors and was talking about within the history, the last several months, the major missteps of communicating. He quoted, I think it was a medical doctor, who was saying the confidence of the WHO has the lack of nuance in the pronouncements has led to these missteps that are really quite costly. It's one of many factors, but specifically around masks and transmission in the air, but also asymptomatic transmission. That potentially there's a communications problem, and it may be an illusion of overconfidence at certain moments that's become costly. We've got a question from the audience. Zhi Pangao from SFU is asking, besides scientism, what role do you think China's rising nationalism played in the push for TCM?
Yeah, that's a major factor. A lot of people against Chinese medicine was saying, and they say undeserved level of government support is because of nationalism, and because it has been strongly associated with nationalism. The very famous expert Zhang Guoli, and he had published a very controversial talk after Wuhan pandemic, like in April, someone, or maybe in May, was upholding nationalism. So it's associated together with Chinese medicine. So yes, it's a lot of people was. So our research here is a chance for me to clarify, is to work to trying to work with this phenomenon, trying to find out what is really working in Chinese medicine in clinic beyond all those discourse of nationalism, of being associated with the government agenda, or this kind of claim against Chinese medicine. We want to find out what's really working in clinic from anthropological point of view, not from medical point of view.
Any last questions for each other? We're a little over time, but I think that's okay if there's anything else you want to follow up on. Well, if not, thank you to the four of you so much, and thank you to our audience who, if you managed to find your way back on, thanks for joining us for this. Yeah, it's been a great conversation. And your projects are fascinating, and also speak to the current moment in a lot of really important ways. So yeah, so thank you for being here.
Oh, thank you for getting us together, Nick.
Sure. Yeah, it's really,
Look
really
at
fun,
it again.
fun conversation.
Yes, and I hope we can continue this conversation in some form.
Yes. Yeah. Great.
Okay.
All right. Well, have